Hi, tonight is our second video blog entry, and unfortunately, I'm not feeling well today. I already feel a hot flash coming on, but there's a little discussion I wanted to have. It's an issue that I'm dealing with personally right now. I find myself about 3.5 weeks or so post op from an oophorectomy and lysis of adhesions and excision of endometriosis. And the topic I want to talk about could be scary and maybe controversial. And it's a 4 letter word. And I wrote it down, and I realized yesterday that all my words were backwards. So, hope. Hope is what we're going to discuss tonight. Now, you're probably thinking, how could hope be scary or controversial at all? Well, if you have a chronic illness, you understand how hope can be scary and controversial for those that don't understand that. Hope is normally considered to be a positive, uplifting, amazing attribute to have. However, if you have a chronic illness that is not easily treated and dealt with, it can be terrifying. You don't necessarily want to walk around being a negative Nancy, thinking I'm never going to be cured, this is never going to get better, my life is always going to be this way. But you don't want to have such high level of hope that you think everything's going to work, and then when it doesn't, you're devastated. I have found myself on both sides of the coin. And so what it's about is finding balance. You don't want to be overly hopeful, thinking that anything you try is going to cure you, at least with endometriosis. Maybe this next diet I try will cure my disease. And then when it doesn't, you can find yourself in a depression, a dark place. And so I think it's important to find a balance in between hope and hopelessness. Hopelessness will get you nowhere. So you have to have enough hope to keep you going, enough hope to keep trying for the next thing, finding a new doctor if your doctor's not working, enough hope to keep going that one more day. I've been in the place where I've wanted to kill myself, which is hard to say because I know my friends and family will be watching this and some of them may not know that. But it's true. And if you don't give yourself that one more day, you don't know that you couldn't feel better. Like right now, I don't feel well, but it's not from the disease I had surgery for, it's other issues. And had I killed myself any of the numerous times I wanted to, I wouldn't have the opportunity that I have now to be healthy and to eventually just enjoy life and be a happy, normal person with the normal trials and tribulations instead of the massive trials and tribulations that you have when you have a disease like endometriosis. So I found a quote about hope by Desmond Tutu, who's from South Africa. And this quote, I think, really helps at least show my point of view on hope. And it is, hope is being able to see that there is light despite all of the darkness. So I'll repeat it again. Hope is being able to see that there is light despite all of the darkness. And that's Desmond Tutu. And I think that's the perfect quote because it doesn't ignore or deny the darkness of the tribulations that we can go through, especially with chronic diseases, specifically speaking about endometriosis, because that's where my experience has been. And hopefully that's the only one I can speak about ever. It acknowledges the darkness, but it also acknowledges the light, the hope. So I hope, that my sisters out there, maybe this can be a reminder for you that just because you're having possibly a very difficult day, which I've had. I've slept naked on the bathroom floor because I couldn't get up. I have bruised my chin from puking in the toilet too many times. I've bled through countless pairs of pants. I've had my pants rip because I was so bloated. I've had countless people ask me when I'm due because of the endobloatation that happens. I've had people reach out and touch my stomach and ask when I'm due while I'm shopping. I've gone through a lot with my disease, and so I understand the lows of the low from endometriosis. And I just want you to remember or to hear for the first time that you can get better. Maybe there's not a cure for endometriosis yet, but there are treatments that can help relieve the symptoms, at least a little bit, if not more. And someone told me once that, like a bow and arrow, as far back, if you think of as going backwards, like we are with endometriosis, we're going backwards in life, which is something we'll discuss in a later video blog. I apologize if you hear my cat meowing. He wants to come in so bad, but I don't want him to wreak havoc on this. So you may hear him scratching at the door in a minute. But, okay, so you think of going backwards as the pain, the puking, the nausea, the bloating. And this is a bow and arrow. So the further you pull back is going to be the further you're able to go forward. So the more crap we go through, the further forward into awesomeness we're going to be able to go. Now, that's not saying that that makes the hard parts that we go through easier, but just think, because of how far down we've gone as people with endometriosis, we can go that much higher after. That gave me a lot of hope through my disease over the last few months, and I hope that that can give someone out there some type of inspiration to keep going, because it's not always going to be as bad as it is when it's on your worst days. I've had many, many, many of those worst days, and I am grateful today to be sitting here, to be hopefully giving inspiration to someone out there who's had the thoughts that I've had. What if I take this bottle of pills? What if I use this box cutter and just nick the wrist a little bit, It would be so easy to do that, and it would be. But then you don't get to experience the joys of life. So I hope that this gives somebody some hope, and I didn't intend for tonight to be a long blog because I really, as I said, don't feel well. But I've been feeling back and forth about hope today because of my not feeling well. And so I thought maybe speaking about it would make me feel better, and it has. So I'd like to thank you for helping me feel better. And I'm going to end with taking a moment every time. So let's just take a moment. Maybe put your hands on your chest if you'd like. And close our eyes. And take a deep breath in. And exhale out. And hopefully this brought you some type of maybe perspective on hope and hopelessness and light and darkness, and there's always a better day. That I can say for sure. So again, I thank you for watching, and I hope those of you that are in the darkest places, I hope your light comes soon. And remember, if it doesn't, to reach out and talk to somebody. And if you need somebody to talk to, I gave my email in my last video blog, and I'll give it in this one. It's A Cardigan Lover, spelled normal, A Cardigan Lover, no spaces or anything, at gmail.com. And please reach out before you do something that you could regret. There's hope for us. There is hope. Okay, so I'm going to sign off with peace, and I love you.